into and out of consciousness. Okay? When we talk about somebody coming into and out of consciousness, we don't mean they're falling asleep and waking up. You're talking about levels of cortical activity. You know, their cortex is active, it's not active. So, if you ever had a situation where you had a loose wire on something, sometimes it worked, sometimes it didn't. This is kind of the brain circuitry analogy. Ooh, akinetic mutism, abulia, catatonia, yes. What are those?
Symptoms.
What? Go ahead.
Catatonia, that's where your body like goes in these weird positions and gets stuck, doesn't it?
Yeah, it's kind of wild. There's a really campy movie, Zardos. I think in all of my years of asking this question, I've had one student that I've seen it. Anyway, there were the catatonics, and they were totally weird because they'd be standing there.
Is it made in the 70s?
Yeah. Sean Connery. Yeah. And like, somebody come along and go, yeah, totally weird. In a state of catatonia, you have no purposeful movement. So, you're just kind of stuck in place. With akinetic mutism, akinetic, it's really no movement. Mutism, no speech. So you cannot speak or move. Abulia is kind of a weird one. That is a total lack of motivation. Motivation is kind of a strange and hard thing to describe. What you have to remember is for every movement that you make, you have a lot of planning that goes into it. You actually have a tremendous amount of decision making that goes on in your brain to determine how you're going to move, what you're going to do, how you're going to do it. When we talk about a lack of motivation, it's the ultimate. A person sitting there and you say, well, what do you want for dinner? I don't care. All right? How about we have fish? I don't care. Want to go to a movie? I don't care. I'm gonna hit you. I don't care. And that, once again, that is rather comical. Unless it is serious. Everybody gets in a mood where, once again, you don't want to do anything. You're in a bad mood, you're in a crummy mood, you don't want to talk to the person who's talking to you, usually especially that person, and you are just not going to agree to doing anything. Now, somebody, however, in a clinical setting, that would be approached, for this. How about we have breakfast this morning? I don't really. Okay. Why don't we get up and get dressed? I don't need to get dressed. Like that. That's what they talk. That's what they mean in referring to. The abulia, yeah, a total lack of, lost the word, and there it is. Total lack of motivation for doing anything. Locked-in syndrome is really weird. Typically with locked-in syndrome, a person cannot move or speak but they can have a cortex that seems to be pretty much functional, but they lose the reflex centers in the mid part of the brainstem, so that signals, remember, signals to the pons are coming from cerebellum, coming down, signals passing through here. Signals just get short-circuited, they don't go anywhere. Typically, though, people with locked-in syndrome can still move their eyes and respond to questions with eye movement. There was a house episode with Maz Def, and I think he was locked in. So anyway, I miss House. So yeah. So how do we look at all of this stuff pulled together? So we have brain death, coma, vegetative state, all of these other, profound apathy, yes, semi-coma, yes, you're in a lethargic, stupor-driven semi-coma, locked-in syndrome, dissociative disorders. Dissociative disorders, that's more a psychiatric scenario than a neuroanatomical scenario. So when we talk about these, okay, cerebral cortex, do you have a purposeful response to stimuli? Diencephalon, behavioral arousal, and sleep-wake cycles. So behavioral arousal means you respond to things appropriately. Where it says brainstem up here, do you have the reflexes? Spinal cord, do you have the reflexes? So we can actually divide most of this up into a simple series of yes, no, question, and response. Now what you're going to see is that some of these are hard to separate. So brain dead. No cerebral responses. No upper brainstem diencephalon responses. No motor reflexes or brainstem reflexes. Spinal cord, yes, we have spinal cord reflexes. How would I tell that?
The knee.
The knee thing. What knee thing?
You
Knee-jerk reaction.
Yes.
Yes. Yeah. So you all know that, right? Then you hit right here on the knee and you kick out. You can't stop that one. And that's the typical one to use. However, if you have somebody who is brain dead, chances are they're not going to sit down in a chair for you. So what else could I do for a spinal reflex? Do what? Yes, the withdrawal response. So you would literally take a needle or pin or something and poke them, and you will have a withdrawal response. Yeah.
Would it be just more like a twitch, or would it be an actual?
It will be a twitch. Why would it be more than that? Because you can't generate the signal to have the full response. In theory, you could, but usually if you're brain dead, you have pathways that are really deteriorating. So, yeah. In coma, we have brainstem activity. So we have brainstem reflexes. Typically, when we talk about brainstem reflexes, we're talking about respiratory reflexes, cardiovascular activity. So this I think is a nice little way of looking at all of these various states of consciousness together. If you go to sleep, normal and abnormal, all right? Normal sleep, you have all the functions. Abnormal sleep, you can have disruptive cerebral cortical functions during abnormal sleep. Example of abnormal sleep, sleep apnea. That is actually abnormal. So, I'm trying to think of another example. That's the best one. So, yeah.
What about night terrors? Does that qualify?
Nightmares or night terrors? Night terror, yeah, I think night terrors would qualify. Are we all familiar with night terrors? Night terrors are beyond bad dreams. Occasionally on night terrors, the person will appear to actually be awake and responding to their horrific experience. Usually they are some form of hallucinatory response, so that you think that I don't know, the person sleeping next to you in bed is I don't know, an evil Russian spy, and in your terror of the situation, you kill them. You know, usually we don't kill the person sleeping next to us. So yeah, I mean, there actually is a big amount of literature on that. Possibly restless leg syndrome might also fall into that category. On occasion, people will have abnormal heart rates. In other words, their heart will race or slow down a lot. So there are a lot of possibilities in there, and they're all due to cortical function. So I think, as far as I know. Oh, what else I want to do with all of this? I think this is maybe enough. We are going to stay with the brainstem. We're not going to be leaving the brainstem for the near future. Pretty much for most of the rest of the semester, we're going to be in the brainstem in the mid-grade. So, but I think this is a good place for us to break, philosophically, at least for me. I think, once again, all these slides are already up, so I won't put them up again. And I think all of this was in there. Yeah, you looked at it? So, yeah? Okay. Other than that, how's everybody doing? Still all doing okay?